Did you know that more than 1 million people in Australia carry a gene for cystic fibrosis? Nationally, that's 1 in 25 Australians. Every 4 days, a baby is born with cystic fibrosis, and most of these babies won't even turn 40 years old. One of these people is my sister's friend. She and her partner recently had a baby that was diagnosed with cystic fibrosis, a disease they hadn't even heard of before, and now their whole lives have changed. Cystic fibrosis as a disease has many faces: salty sweats, abnormal stools, coughs, repeated lung infections, and thick mucus that clogs the lung, making it impossible for them to breathe. There's no cure, and patients face lifelong treatments. Kids as old as 6 years already have to take up to 40 different tablets every day and face hours of physiotherapy just to stay healthy. And here comes the wall. By taking all these different medications, interactions with each other are likely to occur, which affect each other's concentrations. For example, if the concentration of a drug gets too low, this can result in treatment failure despite taking these expensive medications. If concentrations of a drug get too high, this can increase side effects and toxicity, making these patients even sicker. To break the wall that stands between cystic fibrosis patients, the medications they so urgently need, and the best quality of life, we have developed a test that measures multiple drugs in one single test. We take a plasma sample from patients and we get the concentrations back. We can then work with clinicians to optimize the treatment of these patients based on the patient's individual profile, like age, gender, and co-medications. We have developed an algorithm that helps us model these concentrations and also predict patient outcomes in the future. We can reduce hospitalizations and reduce side effects as well. We want cystic fibrosis patients to have the best quality of life they can possibly have and help them celebrate birthdays past their 40th. Thank you.